Heart attack is a very common cardiac condition which can be life-threatening. Anytime somebody has chest pain, you always fear if you're having a heart attack. Today, let's look at what heart attack is, what are the causes of heart attack, and how it can be prevented. Heart attack is when the blood vessels in the heart is suddenly blocked due to fat deposition and so forth, leading to impaired blood circulation to the heart muscle, causing chest pain and then leading to heart muscle damage. This is what heart attack is. Why does heart attack happen? We all know that high cholesterol is one of the important reasons for heart attack. High cholesterol, particularly the bad cholesterol, namely LDL cholesterol, gets deposited in the blood vessels by a process called atherosclerosis. And due to various reasons, there are cracks in these fat deposition. It's called as a plaque rupture. When the plaque ruptures, there is sudden clotting of blood in the blood vessels, leading to blockage of the artery. What are the risk factors for atherosclerosis and for fat deposition? Apart from high cholesterol, there are various other risk factors, the most important being diabetes. Then there is smoking, high blood pressure, obesity, and a sedentary lifestyle. These are all called controllable or modifiable risk factors because once these are detected, we have means to control them. There are also non-modifiable risk factors such as genetic risk factors, family history of having blockages in the heart at a very early age, and elderly individuals and males are at a higher risk of a heart attack. When someone is having chest pain, particularly someone with all these risk factors is having chest pain, can we find out if this chest pain is because of heart attack or not? Yes, sometimes yes, because heart attack produces a very typical kind of chest pain. It is usually a very crushing, intense pain at the center of the heart. Sometimes it is a feeling of heaviness. It is so heavy that sometimes people say that I feel as if an elephant is standing on my chest. And this pain can sometimes radiate or move to either the neck or the jaw. It can go to the back of the chest and very often to the left arm all the way down to the left hand. This is what a typical heart attack chest pain is like. Along with the pain, you can have sweating, breathing trouble also. Often this chest pain can last long up to 20 minutes or more. So these are the typical symptoms of heart attack. But unfortunately, a lot of people may not experience these typical symptoms. Particularly patients who are diabetic, women, as well as elderly individuals may not experience this kind of chest pain. They might have very vague chest discomfort, a gas-like burning sensation, or some people may not even have chest pain. They might just have breathing trouble. This is particularly important in diabetic patients because in diabetic patients, due to nerve damage, they do not experience pain and they present with very atypical symptoms. And diabetic patients are at the highest risk of having a heart attack. So very often, just from the symptoms, it is not possible to differentiate if the chest pain is due to a heart attack or not. And the only way to find out is actually to do an ECG or an electrocardiogram. When you do an ECG, when you're experiencing the chest pain, you can tell if the chest pain is because of a heart attack or not. Heart attack can be verified using multiple tests, including an ECG, an echocardiogram or an ultrasound of the heart, as well as a troponin blood test. If these tests suggest that you have a heart attack, the next thing to do is to open up the blocked artery. This is best done by a coronary angioplasty procedure. This is a procedure which is done in a cardiac catheterization lab, wherein the block is detected and the block is opened up using wires, balloons, and then a metal tube called as a stent is implanted to keep the artery open. Very often this is done as an emergency procedure and it is called a primary angioplasty. But an angioplasty can only be done in a hospital having a cardiac catheterization facility. If you are not nearby such a hospital, the other alternative is to give a medication, and that process is called thrombolysis, wherein a very potent injection is given which is able to dissolve the clot. But unfortunately, thrombolysis may not be successful in 100% of patients. On the other hand, angioplasty is successful in a very high percentage of patients, probably around more than 95 to 99%. The heart muscle is very unique in the sense that once it is damaged, it is very difficult to recover the heart muscle. There is a saying that when you're having a heart attack, time equals muscle, which is every minute which passes on without opening the block, you're going to lose more and more of heart muscle, which is why it is very important to open up the blood vessel during a heart attack at the earliest. Unfortunately, particularly in diabetic patients who do not experience a typical chest pain and they think they're having some gas trouble and do not go to the hospital, a heart attack is detected very late, and by the time they come to the hospital, they have already undergone the heart attack and a major part of their heart muscle is already damaged, and there is not much we can do to rescue that heart muscle. So to sum up, we talked about what heart attack is, what are the risk factors for heart attack, how does typical chest pain during a heart attack feels like, but all people may not have such a pain, particularly in diabetic patients, and the only way to find out is to get an ECG and confirm if the chest pain is from a heart attack or not. Once it is diagnosed, the blocked artery has to be opened at the earliest, preferably by an angioplasty procedure. If angioplasty is not available, thrombolysis or dissolving the clot is another option. But the key is to detect it. If you're having a chest pain, particularly in those who are having the risk factors, make sure you go to a hospital, get an ECG, diagnose the heart attack, and open the blood vessel at the earliest. Thank you.